everybody, it's Kara Thomas again. I'm about to do Campus Lab 7. I verified the doctor's orders for this patient. He needs to have respiratory, cardiac assessment, heat, neurological, musculoskeletal, gastrointestinal, and genitorinary. All right, so first thing I'm going to do is move into the room. Hello, my name is Kara Thomas. I'm going to be your nurse today. So what I'm going to do is provide the patient some privacy and practice hand hygiene. All right, do you mind to verify your name and date of birth?
Brian Douglas Reed, and my birthday is March 3rd, 1987.
All right, good. Thank you so much. If you don't mind, if you could go ahead. Are you comfortable with sitting up?
Yes.
All right. If you want to bring your legs to the end of the bed. Got room? You come down here. Come closer. All right, thank you. All right, so the first thing I'm going to do is I'm going to inspect the head, face. Everything looks symmetrical. And have you had any headaches lately? Okay. All right, and then I'm going to inspect symmetry for the ears. So I'm going to look at the tragus to the eyes. And same on this side, from the tragus to the eyes, and it looks symmetrical. Do you wear any hearing devices?
No.
Okay, no problem. All right, then I'm going to do the, inspect the eye. So I'm going to look into the eye. See that? Okay, and then I'm going to put this in the middle, and then I'm going to have you look over my shoulder that way. And then look at this, look over my shoulder. All right, good. And then I would also dim the lights and then do it again to make sure it also works. Okay. All right, and do you wear any glasses or contacts?
No.
Okay, no problem. And then I'm going to look at the, in the nose to make sure it's open, look for patency. And then what about your nose? Any problems with breathing?
No.
Okay, wonderful. All right, and then also with your ears, I'm going to stand over here. I'm going to say 3 words and then repeat it back.
The big bad black.
All right, good. And then I'm going to also stand over here.
Happy birthday, Brian.
Okay, good. All right. So then, next thing I'm going to do is, now that we've done that, I'm also going to ask you to open your mouth so I can look. She's like, look at your gums. Okay, so your oral mucosa is moist and pink. And then I'm going to look at your neck. So this is midline, the trachea. Go ahead and swallow. Any difficulty with swallowing?
No.
Okay, great. All right. So next I'm going to go on to a neurological assessment. So can you tell me your name?
Brian Douglas Reed.
All right, thank you. Do you know what month it is?
September.
Do you know who the president is?
Trump.
All right, thank you. Do you know where you are today and why?
I'm at the hospital.
Okay, and what are we doing today?
Checking on respiratory.
All right, good, thank you. All right. Okay. Let's keep going. And have you had any issues like with being able to think or anything like that?
No.
No? Okay, wonderful. All right, so now I'm gonna check here. Okay, so breathing looks good. It looks like both sides of the chest rise and fall equally, so bilaterally they're equal. Excuse me. All right, so next I'm going to listen. I'm going to auscultate. Make sure I do this the right way. Alright, oh, that's on. Okay, so the first thing I'm going to do, every time I touch you, just breathe deep. Alright, breathe deep again. Breathe deep. Alright, so I did 4 anterior, and now I'm going to do 4 posterior. So every time I touch you, just breathe deep. Breathe deep. Two more. Take a deep breath. One more. Now I'm going to do 2 laterally. Lift up your arm. Breathe deep. This side. Okay, I heard a tiny bit of wheezing right there. Any problems with coughing? Anything? No? Okay. All right, next I'm going to inspect for jugular vein distension. Distension. I don't see that. All right. Now I'm going to palpitate pulses. All right, so go ahead and do your brachial pulse. All right, then I'm going to do the other one. I'm just doing this for 30 seconds. All right, great. Okay, so then I'm going to do another. I'm going to do the brachial artery. We need to do 2. We need to do 2 of the upper limbs and 2 of the lower. All right, and I can feel that pulse, and I'm also going to give you this side. All right, great, and I can feel that pulse. All right, so the next thing I'm going to do is do 2 lower. So I guess what I will do is behind the ankle, so posterior tibialis, and the other posterior tibialis. And I'm going to feel for the foot right in that nodule, and then on the other side as well. Alright, so now I'm going to go ahead, actually first I want to check for capillary refill. So we're just checking to make sure that the blood comes back quickly. And it does. Check my other fingers. And while we're doing this, we can check for clubbing. And then check for edema in both the upper extremities and the lower extremities. I don't feel any swelling or any edema. All right. Next, I'm going to auscultate the heart sounds. So first, I'm going to listen for the aortic. Then I'm going to listen for a pulmonary. It's louder. And then Erb's point. Tricuspid. And then the mitral valve for a whole minute. Any chest pains lately or anything?
No.
Okay, good. All right, so next what I'm going to have you do is lay flat. Come closer, Cece. And what we're going to do is we're going to inspect the abdomen. Check for any scarring or anything like that. And then we're going to auscultate bowel sounds because we don't want to palpitate. We don't want to increase bowel sounds. So what I'm going to do is start in the here. And then go up. I do hear bowel sounds. Must be hungry. Then go over. And then down. Alright. Okay. And we also listen for vascular sounds. Next, hold on, buddy. Next we're going to do is I'm going to palpitate lightly in each quadrant to feel it's tender. Sorry. All right. When was the last time you had a bowel movement?
This morning.
Okay. What about past gas?
About 2 hours ago.
Okay. Thank you. All right, and come on, let's sit up. Now what we're going to do is we're going to do some musculoskeletal exercises. What I'm going to have you do is I'm going to have you try to push your arm forward, and I'm going to push it back. So go ahead, push it forward. All right, so you have strength in that arm. All right, now try to push your arm back like you're extending it. All right, good. And then this arm. All right, and we'll do the same for your right. And lift it. Good. All right, good. Okay, now let me see you take your fingers and spread them out. That's called abduction. And bring them together. That's adduction. All your fingers. Okay, good job. All right, and let's see what else. If you want to go ahead, go down, Cece. Can you roll your ankles? Like circumduction, that's what we call that. All right, good job. All right, are you able to bring your leg all the way forward? Extend it. Extend it. All right, do the same with the other.
This one's tough.
All right, I'm sorry. Okay, you can put it back down. What about plantar flexion? Point your toes down. Point it up. Point your toes down. Point it up. All right, and let's come up here. Let's see now. Can you, your arms forward, go to the side, and lift them up. All right, yeah, you can go. Okay, now you can put them down. All right, and then you can stand up. All right, and you can cross your arms. Close your eyes. You feel like you're gonna fall? All right, now walk towards CC, heel to toe, get his feet. No, you can look now. Go heel to toe. Then come back. You can turn around. All right. Any problems with balance or anything like that?
Yes.
Okay, what's the problem?
Sometimes I lose balance because I got rods that I gotta live with for the rest of my life. So sometimes I do lose a little balance.
Okay.
From time to time, depends on the weather. And today it's thunderstorming, so might sometimes lose my balance.
All right, understandable. Any other concerns?
No.
All right, well, thank you. And I will let the doctor know that and see how he can help you with that. And that's the end. Bye, everybody.